This video will help you to get to know your new ARTEK Pro therapy system. The ARTEK Pro was prescribed to you to aid in your recovery by delivering cold or heat thermal therapy and/or intermittent compression therapy to your injury site. The ARTEK Pro comes with everything you need to optimize your recovery. Therapy settings are prescribed by your physician and should only be used in accordance with your prescription. Inside, you will find the system user manual, wrap kit, power supply and cord, and ARTEK Pro device. Be sure to read the user manual thoroughly, including all warnings and cautions before using your therapy system. When using your system, be sure to only use the accessories and power supply that were provided with the system. The wrap kit is specifically designed to use with the ARTEK Pro and includes everything you'll need for therapy. You can access videos that demonstrate wrap application to individual body parts by clicking the QR code on the wrap or located in the user manuals. Be sure to read all included user manuals, including the one in the wrap kit, to understand potential risks in using the ARTEK Pro. The risk of cold injury is present even when used correctly. Be sure to read the device and wrap instructions to understand all warnings and cautions prior to use. Never place the wrap directly on your skin. Always apply the wrap over a dry skin barrier or a thin piece of clothing. Extra precaution should be taken with the foot-ankle application. The potential for cold injury is greater with extremity application. The system's user interface has several LEDs to indicate system status. Buttons are used to control system operation. The power LED indicates when power is supplied to the system. The timer button is used to select active therapy time. The cold, heat, and compression buttons turn on and off the respective therapies. When therapy is active, the corresponding LED will illuminate blue. The fault LED indicates if the system detects an operation error. Other yellow LEDs on the face of the unit indicate the specific fault. The details of each fault can be found in the troubleshooting section of your user manual. To set up your system, we first need to fill it with water. To start, remove the wrap from the wrap kit and connect it to the end of the hose. Lay the wrap flat next to or below the level of the device. Have water available in an easy-to-pour from container. Connect the device to wall power. All lights will immediately illuminate and the power and 30-minute therapy selection will remain on. Remove the reservoir cap and fill the reservoir with water. With the reservoir full, press the heat button. The blue light above the button will illuminate. You will hear the pump start. As water flows into the wrap, continue adding water to the device until the system volume becomes stable. Pick up the wrap and shake it to release large air bubbles in the wrap. Add additional water until it is 1 inch from the top of the reservoir and replace the cap. Press the heat button again to stop flow. The ARTEK Pro is now ready to use. Tip: do not open the reservoir when the therapy is stopped. Opening the reservoir with the full wrap connected will cause water to backflow out of the device and into the trough area around the reservoir. If this happens, simply clean up the spilled water and be sure to refill the device when starting the next therapy session. With setup complete, apply the wrap to the site of injury. The instructions for wrap application can be found in the wrap kit. Instructional videos are available for each wrap application using the QR code on the wrap or in the user manuals. The application procedures described in the wrap user manual may need to be altered due to anatomy or injury state. The wrap may be applied as you see fit, as long as 3 rules are followed. The wrap is always applied over a dry skin barrier or a thin piece of clothing. Never apply the wrap directly against your skin. When applied, make sure the wrap lays flat against your body without any folds or kinks, and the tubing extends straight away from the wrap and not folded back on itself. The wrap is not strapped too tight. You should easily be able to slip one finger between the wrap and your body. For this demonstration, we're going to set up the ARTEK Pro based on a prescription for 60 minutes of cold therapy combined with compression therapy to the knee. Always use the settings prescribed by your physician. If you have any questions about your prescription, please contact your physician. With the wrap applied to your site of injury, press the timer button to select 60 minutes, then press the cold button to start cold therapy. Next, press the compression button to start compression therapy. For the therapy selected, a blue light will illuminate, indicating therapy start. When you start cold therapy, it will take about 40 seconds for water to start flowing to the wrap. Compression therapy will initiate soon after the thermal therapy starts. During cold therapy, you may notice changes in flow or pulses of cold. This is normal. Once therapy is started, the therapy time cannot be changed. If a misselection was made, stop the therapy, adjust the timer, and restart therapy. During active therapy, the alternative thermal therapy is disabled. To switch thermal therapies, stop the current therapy selection, then select the alternative. After the set therapy time, the system will go into rest mode. This will be obvious to the user as a therapy light will begin to blink. If compression therapy is also active, this therapy will continue through the thermal therapy rest period. The rest period will last for 15 minutes and is not adjustable by the user. For your safety, do not skip the rest period. After the rest period, active therapy will restart automatically and the cycle will repeat until the user stops the system. If a short break is needed, stop the therapies. Disconnect the wrap from the hose and leave the wrap applied to your body.